Hormonal treatment makes big difference in the redistribution in the fat in the face, but not completely. Using some fat transfer to certain areas in the face, like for example the cheekbones, around the eyes, can enhance the final result also in combination with the forehead surgery, creating a much more feminine look. Lipofeminization is a very safe technique. First, we harvest some fat from the abdomen, the inner thighs, sometimes the hips. Then we purify that fat, and that purified fat is reintroduced in some areas in the face using very small and blunt cannulas. The areas we like to treat are basically the cheekbones and also around the eyes to give you a much more feminine look, also in combination with the forehead reconstruction surgery. Facial lipofeminization can be done in combination with the other procedures under general anesthesia, or if it's just an isolated procedure, can be done under simply local anesthesia with some sedation. Technically speaking, what we do is microfat grafting. So it means when we harvest the fat from the belly or the inner thigh, we use very small cannulas with less than 1 millimeter of diameter. And also when we re-inject the fat in the face, we use this type of cannulas as well. Using blunt cannulas, we do not damage the blood vessels. And also using these micro cannulas, we introduce very small deposits of fat. Then we can ensure the blood supply of these deposits. With nanofat techniques, we can enhance the appearance of the skin by introducing some growth factors, and then we can treat the hollow areas around the eyes. Lipofeminization is considered to be a permanent filler, but we have to take into consideration as well that sometimes it suffers some resorption. It means because of this resorption, sometimes we have to go for a second procedure or even a third one. The resorption rate may vary according to different areas in the face. For instance, the areas with a lot of mobility, like such in the lips, may suffer a higher resorption tax than in the cheekbone area. Like any fat deposit in the body, the fat transferred to the face may vary according if you lose or gain weight. So if you're losing weight in the body, it may affect as well the fat we have injected in the face. That's the reason we don't like to make an overcorrection of the area to treat, because if that fat stays forever, then we have a problem. If some resorption happens, then we can go to a second or third injection, at least separated 6 to 9 months. After a facial lipofeminization, you may expect to have some bruising and also some edema around the areas we have already injected the fat. This bruising will disappear in 2 to 4 months after the surgery, and there is no real pain. You just will feel some kind of discomfort that can be solved very easily with some painkillers. When we introduce the cannula to re-inject the fat, we use very little holes, which even do not need to be stitched, and there is no visible scar at all. After this procedure, you can go back to your daily routine very quick and very easily. Let's say the day after this procedure, you can go to work. If the amount of volume we want to get is really big, it's better to split the treatment 2 or 3 sessions instead of doing everything in one shot, because if we add just a big volume in one shot, for sure we will have a dramatic resorption of that fat. So it's much better to use small amounts and split it 2 to 3 times. If you're looking for a drastic change in volume, maybe this is not the best option for you, and you may look for an implant, for example, or different treatments.